Hello, I'm Carmen Acevedo. I'm from Ozone Therapy USA. I'm very pleased to be with you today and talk about the science behind ozone therapy, especially the Madrid Declaration and ISCO 03. Um, okay, let's get started. So to talk about the science behind ozone therapy, we should go at least a brief history of the use of ozone therapy as medical tool. Because how this natural gas is just a molecule of three oxygen atoms, which is the third most oxidative molecule in the planet, have become a powerful tool within the bioregulatory medicine. And let's see how ozone therapy is going to play a role in the 21st century. Okay, let's see the historical background of ozone therapy. I've got three slides. So we're going from 1700 to 1800. And the very first time we heard about ozone was in 1783 when Van Marum noticed a particular smell near an electrical circuit, and that smell is that's why ozone got this name, because ozone is means smell. Okay, but then in 1860 it's used the first time as a disinfectant for surgery rooms, and that is very important because it's the first time that it's recognized as a potent germicide. And it's at the end of that century when Nikola Tesla proposed the first ozone generator. So as you see, in the whole century, ozone from the very beginning is being placed as a very potent germicide. Okay, then we go to Hamburg in Germany at the beginning of the 19th, when ozone was used as a disinfectant for the water in cholera epidemic in Germany. And also in 1940 is in France when the rectal insufflation of ozone is used for the first time as a medical treatment. And then in 1977, a Russian guy introduced the ozonated saline solution. And it's almost in 1980 when a German also introduced this book, The Medical Ozone, and talk about the minor autohemotherapy and the major autohemotherapy. So let's see what's happening in the 21st century. And it's very interesting because it's now when the ozone kind of kick off. In 2001, is Ukraine the first nation that recognized the use of ozone in medicine. And for us, this is a very important day. But then in 2010, in Vienna, the International Scientific Committee for Ozone Therapy is founded, ISCO 3, and the first Madrid Declaration was published, which is the most complete and upgraded guideline on the practice for ozone therapy. And now we've got the third edition. I'm going to talk a bit about those in 2015 and 2020. But this 2013 is very important because Piccorelli first discovered the basis of the mediation of this nuclear factor that everybody talks about, NRF2 is the mechanism of ozone action. So now the molecular biology behind the ozone therapy is much more well understood. But then in 2015 is also a quantum leap, because now more than 50 countries validated the ozone therapy as an adjuvant treatment, by more than 40 scientific associations founded. Also in Germany, in China, Russia, and Italy, you can see a lot of ozone therapies qualified. And then in 2015, Brazil is the first country that recognized the practice of ozone therapy in dentistry, which is very important. Now in 2020, well, Brazil again is the first country to recognize the practice of ozone therapy in veterinary, which is also a quantum leap for us. And of course, with the pandemic, We've got a lot more than 16 clinical studies published by now on COVID-19, and this is very good because it's based in this viral infection. Okay, for us it's very relevant these associations. Of course, here in the States, the American Academy of Ozone Therapy with Dr. Schallenberger, who's been working with ozone for more than 30 years, I think. EMEOF is not as active as ISCO3, but it's also an international medical ozone foundation, which is also very active. And ISCO3, which is, as I said, is been founded in 2010, and we publish this Madrid Declaration every 5 years, and I'm going to talk a bit about Madrid Declaration a bit later. Okay, this is very interesting because just to have a glimpse of what is being published in ozone therapy, we used to kind of divide that in preclinical research and clinical research. This is very important for you to note. ISCO3 is got a database in Zotero, and this is the source of this chart. The total number of records by 2020 was 3,177. Of all those, preclinical publications were 603. Is almost 21% of those all records in Zotero, which is the database of ISCO3. And the 10 subjects that we can find in this preclinical research are, of course, infectious diseases. As I mentioned, this has been used to disinfect not just water and as a germicide. So it's of course, in infectious diseases, it's very, very big. As an antioxidants as well, dental, of course, and blood in oncology, urology, cardiovascular disease. Almost 40% of all these publications talk about ozone in cardiovascular disease, also in gastrointestinal, in toxicology, and in neurology. So this has been the source until 2020. But now let's talk about the clinical research. And it's much more interesting because in the same source in Zotero, ISCO3 database, the total number, this is now until August 2021, a few months more, 3,672 total records in ozone publication. In a clinical study, 2,497. Almost 70% of all the database in ISCO3 is about clinical study. And this is amazing, really. And the top 10 subjects are a bit different. Of course, musculoskeletal, because we'll see how effective is ozone therapy for those kind of diseases. Dental as well, ulcers and wounds, infectious diseases again, hemato-oncology, very, very studied, cardiovascular, pain, gynecology, endocrinology, and immunology. So when people ask you, it's not a science, well, you can go to Zotero in the ISCO database, and you'll get a lot of records about ozone therapy in clinical research. This is very important as well, because this is not our data. It's the data published in the PubMed central database in the last 10 years. And this is very, very amazing. If you put the keyword ozone therapy, you'll find in 2010 only 394 publications. And the decade goes on. In 2020, there is 1,421. Amazing how in just 10 years, a lot of publication. And if we see it this way, in PubMed 2020, the total publication were 10,000, and in ozone, 1,421. That means that 40% of the total publication in PubMed in 2020 were about ozone therapy. That means 4 articles per day in the whole year. And then if we go now to 2021, the first 8 months, we've been published 922 publications in ozone therapy. It's amazing. So again, 4 articles per day is being published in PubMed, the central database. So as you see, there is a lot of things going on, and it's very exciting for us. So this 21st century is going to be exciting for ozone therapy. Okay, so I've told you the Madrid Declaration is a publication from ISCO 3. It's a complete and updated guideline on the clinical practice of ozone therapy. We've got already 3 editions, 2010, 2015, and 2020. And I bet 2025 is going to be very good because all these publications about the pandemic. So what can you find in the Madrid Declaration? But first you can find all the pathologies that benefit from ozone therapy. We grade it in the different levels, of course. This is level A, with very good scientific evidence. This is level B, at least a first scientific evidence. Level C, at least a first scientific evidence that suggests that there is a clinical benefit provided by ozone therapy. So let's see, it's a very broad kind of list of diseases, but just to have a glimpse what you can find in the Madrid Declaration. Of course, diseases in level A, all the musculoskeletal diseases, this herniation, spinal diseases, knee osteoarthritis, all these local infiltrations of ozone. And as you see here, these numbers that are the reference when you go to the Madrid Declaration to find all this. Diseases in level B in orthopedic as well, very strong, musculoskeletal soft tissues and all those you see here. Other disease in level B, infectious diseases, as I told you, is very strong, and dental cavities they've been using like routine now. All these infections also in those caused by bacteria resistant to antibiotics or viruses, especially hepatitis, HIV, herpes, the papillomavirus, fungi. So infectious diseases is very big for ozone therapy. And here you can see a lot of others. And this is especially diseases when you use ozonized solution and ozonized oil for topical use. So you can have a lot of things you can treat. Here is very important to say that as an adjuvant treatment, all these diseases in level B being very effective ozone therapy. In diabetes, all these chronic diseases, in fatigue, in fibromyalgia, as an anti-aging and antioxidant treatment, of course, in rheumatoid arthritis and lupus and cancer as well, cancer-related fatigue in chemotherapy and radiotherapy side effects. And here, this quote I really like because the ozone therapy associated with allopathic treatments may accelerate and improve results. And that's what we really do. We kind of combine the allopathic treatment with ozone therapy, and the results are amazing. In asthma, I've seen a lot of vertigo and tinnitus in the last few months. I don't know if because of the COVID or because of the vaccine, but also it helps a lot. Also, it might be useful, but there is not real clinical evidence in all these diseases. In autoimmune diseases, of course, it's very useful. The thing is we need to publish more. If we can join together all the people that are doing ozone therapy and sit down and do a very good publications in clinical trials, it's not going to be a huge one, but we need more evidence in these kind of diseases. And the list goes on in ophthalmology, in pregnancy, and preeclampsia, infertility, vascular diseases, of course, everything that is ischemic heart disease is very good. Cancer metastasis, kidney failure, you name it, okay? So all these diseases are graded in the Madrid Declaration, and you can go and check it out. Another very important thing that the Madrid Declaration proposed every 5 years is the contraindications for the use of ozone therapy, especially the systemic route. And these are the 9 more important, of course. The glucose 6-phosphate dehydrogenase deficiency, which causes favism. And if you use ozone therapy, you can create an acute hemolytic anemia. So you better test your patient before you use systemic routes. Acute alcohol intoxication, I don't recommend that, and for me it's a very strong contraindication. Of course, hemochromatosis and patient receiving iron and copper treatment, especially intravenously, because of the phantom reaction, and well, you can also create a hemolytic anemia. So of course, all these pathologies that are not balanced, you have to be very careful. You give ozone therapy in the patients that are compensated. The thrombocytopenia with less than 5,000 platelets can be a problem, especially if you do a major or the 10 passes. Also anemia, be very careful if you have less than 8-9 grams of hemoglobin. Other than that, it's very safe and very secure. Adverse effects. In the Madrid Declaration, we got a huge list of side effects. We have to report everything that goes within these 5 years, but the side effects normally are very mild. And the most reported side effects could be related to, of course, the lack of training in ozone therapy. That's why we, from the ISCO 3, we recommend the training and the people to go and study about ozone therapy very thoroughly. The administration technique, be sure that your nurse or yourself have a good techniques. The route of administration, of course, and mainly the ozone concentration used. And I'm going to deep dive a bit with the ozonated saline solution about the concentrations used. Madrid Declaration also proposed that ozone therapy should be done by cycles. Each cycles is the systemic route between 5 and 20 sessions per cycle. The local route about 5 to 10 sessions per cycle. It's just because you have to, it requires activation time, and so that's why it's been demonstrated that works the best. Of course, all that is tailored to your patient, depending on the type of disease you treat him. The redox status of the patient, that's very important, because if the redox status is high, you have to go very slowly with low doses and going up. Of course, the protocol to be prescribed by you. The main route of administration that Madrid Declaration proposed, of course, are the major and minor orthohemotherapy. I particularly use a lot of minor orthohemotherapy. We call it autovaccine. They're very good and very simple and easy. The rectal insufflation and the ozonized intravenous saline solution. Of course, the vagina also is described in the Madrid Declaration. And the local one, well, intramuscular, intradermal, external, like the bagging, or local. So this is a typical chart you're going to see in the Madrid Declaration. Well, you see the local application, and you've got the route, the concentration, and the doses. Here, for example, bagging, paravertebral, you get the concentration in micrograms per normalized milliliters, the volume you should use, and the dosage you will get with high, medium, and low levels of ozone. And if we go to the systemic application, these are the main we use: the major, the minor, vaginal, the rectal insufflation, and the ozonated saline solution. Here again, you can see the concentration in micrograms per normalized milliliters. We don't use any more gamma. We kind of use this way to say it, the volume, and also the dosage, okay? And you have some remarks here, like a tips. So let's talk about a bit the Austenite saline solution that I really like and I use a lot. Is carried out with a very low dose of ozone concentrations, which are calculated according to the weight of the patient. So in order to do Austenite saline solution, you have to weigh your patient in kilograms. The low dose is 1 microgram per kilogram. The medium dose is 2 micrograms per kilogram. And the high dose is 5 micrograms per kilogram. We use this device, which is called the dual kit. It's ozone resistant. It's very easy to use and very safe. Okay, so how we calculate the concentration is very easy. You have your patient weight, let's see, it's 80 kilograms. The dose of ozone, let's see, we're going low, 1 micrograms per kilograms. And the volume, I normally use 200 milliliters. You can go less or high, but 200 is kind of the standard. So to calculate the doses, 8 kilograms per 1 microgram per kilogram is 80 micrograms. So which also, to know the ozone concentration you're going to put in your generator, you're going to divide these 80 micrograms in 20 milliliters of saline solution that give you 0.4 micrograms per nano milliliters, normalized milliliters. So this is very important here because ozone, the dissolved ozone concentration is in the saline solution is only 25%. So in order to get the concentration, you have to multiply by 4 to achieve a 100% concentration in the solution. So 0.544 times 4 is 1.6 micrograms per normalized milliliters. That's the one you're going to put into your generator, and then you're going to continuously put the ozone in your dual kit, and then you are ready to go. Okay, always remember it's 200 milliliters per session. The procedure is very easy. You set your equipment. I normally use, as I said, this dual kit that you can do vacuum. I got a generator with vacuum. So you vacuum your dual kit and you transfer the 200 milliliters of saline solution into your dual kit and release the vacuum. Then you saturate with ozone dose in the dual kit and let it bubble for at least 10 minutes. And this is very important because the solution will get saturated in more or less 10 minutes if you're using 200 milliliters. And then you do your venipuncture and infuse the saline solution ozonated in 20 or 25 minutes. And always remember to flush your vein with 10 milliliters of saline solution to protect the veins, and don't forget that ozone is very oxidative and can cause some phlebitis. All right, so the science behind the ozone therapy, now we know why this natural gas, just a molecule of 3 oxygen atoms, which is the third most oxidative molecule in the planet, has become a powerful tool within the bioregulatory medicine. And of course, ozone therapy for me is a game changer in this 21st century. So as Hippocrates always said, natural forces within us are the true healers of disease. And I thank you for your attention, and well, hope you really deep dive in ozone therapy and join the club. Thank you.